normal flow on the right side. So again, we established that we have our vena cavae, they lead to the right atrium, that right atrium leads to the right ventricle, and then that leads to the pulmonary arteries. Now, what what happens if this happens? So what this is talking about normal flow, but can this happen where we have flow occurring in the opposite direction? So can we have flow going from the pulmonary arteries to the right ventricle and the right ventricle going to the right atrium? So can this whole thing be reversed? Well, it's pathological when that happens, so it's not supposed to happen in a normal heart. But what do we call this? So what prevents your blood from backing up? Well, just like your water pipes and your sewage system, what prevents your sewage, your faucet, your sinks, your plumbing from backing up? We have valves, and valves help to maintain that direction. So heart valves are what prevent what we call back flushing, or regurgitation is the correct term for that. So valves, just like your plumbing valves prevent your pipes from backing up, heart valves help to maintain the direction of blood flow in your heart and also in some of your blood vessels as well. So these prevent blood from going backwards because, again, you want oxygenated blood to be carried toward your tissues that need it. You want deoxygenated blood to go to your lungs so they can be deoxygenated. Because, again, if they're back flushing, that means that it's kind of undoing that previous work that you were trying to accomplish in the first place. So the thing about heart valves, remember that your heart is working 24/7. It doesn't take a vacation, it doesn't have a break. So this is why these heart valves, they need not, because the blood is always flowing through your heart, they need to be flexible because, again, blood is always moving. So with the constant movement, these valves need to be flexible. But they're also not going to be very thick, because if they're very thick, well, which is easier to bend and which is more flexible? A thick sheet of paper or a very thin sheet of paper? So again, you need something that's very thin, flexible, but also very strong because, again, your heart is contracting all the time. You have blood rushing everywhere, and it can't just tear apart like a piece of toilet paper. So yeah, when you think of regurgitation, maybe you think of like like a mother bird feeding its baby chicks, or maybe when we talk about regurgitation, in general, it refers to something flowing backwards. And in this case, we have backwards flow. What we do when we eat with our digestive tract, we eat and we digest our food, and right? So we swallow our food. But if we're vomiting, it's going the opposite direction. So regurgitation in the cardiovascular system, this is referring to the backwards flow of blood. So this is going opposite the direction it should be flowing. And the valves, yes, very important in preventing regurgitation. And someone mentioned murmurs. That's also involved in that as well. Okay, so here we have relaxed on the left, and here we have the ventricles contracting on the right. So notice that the ventricles are kind of narrowing that ventricle when it contracts and the muscles contract, and also increasing the pressure as well. But what prevents it from the blood from regurgitating and going from the ventricles into the atria? Notice that these valves, when you go from relaxed to contracting, they actually shut. So why do they shut? Well, the interesting thing is that, okay, they're there, they're holding it in place, but with all this pressure, what prevents the valves from going like this and then inverting like that? Thing is that you have two structures that are very important in preventing your valves from inverting the wrong way. So what we have here are things called the chordae tendineae. So these are actually like strands of connective tissue, and they have a lot of collagen, very strong. And what they're doing is helping to keep the leaflets of the valve in place. So this is they're like parachute strings. They prevent it from the valves from inverting the other ways. If you somehow severed them, yeah, maybe the valves could end up like going the other opposite direction. But not only do you have the chordae tendineae, you also have things called the papillary muscles. And notice that they're anchoring these chordae tendineae to the base of the ventricles, or actually I shouldn't say base of the ventricles, but they're anchoring the chordae tendineae to the ventricular walls. But the other thing about papillary muscles is that they're more than just anchors. When you have contraction of the ventricles, these actually contract as well. So not only do you have the chordae tendineae kind of holding on to the leaflets of the valve, these papillary muscles are kind of like pulling those strings and pulling them toward back into the ventricle to prevent the valves from inverting and having regurgitation. That's why these two structures inside the heart are very important, because again, they help your valves maintain direction. So what we have here between the, oh, this is like, I guess, the previous version. So, but yeah, same things. We have a left and right atrium, and we have a right ventricle and left ventricle. So between the atria and the ventricle, we have the atrioventricular valves. So on the right side, we have the tricuspid valve, and on the left side, we have the mitral or the bicuspid valve. So for mitral and bicuspid, I think it's worth your while to know both of those names, because some textbooks use one or the other or both. So I think it's worth knowing that mitral equals bicuspid valve. But so a mnemonic that works for some people. If you're looking at this particular perspective of the heart, try before you buy. So the tricuspid is here, and then the bicuspid is on that side. So tricuspid is actually on the patient's right, and then mitral bicuspid is on the left side of the heart. But again, we're talking about patient. So again, if this confuses you, don't use this mnemonic. Now in this, we have the right ventricle, and this leads to the pulmonary trunk. And we have our pulmonary valve at the base of the pulmonary trunk. So this is pretty easy. So if the pulmonary valve is at the base of the pulmonary trunk, that leads to the pulmonary arteries, what should we call the valve that's at the base of the aorta? Maybe we should call it the aortic valve. So again, these are pretty easy compared to tricuspid and bicuspid / mitral. So pulmonary at the base of the pulmonary trunk, aortic valve at the base of the aorta. Pretty simple. And these together are called the semilunar valves. So again, AV valve, the atrioventricular valves, they're between the atria and the ventricles, but the semilunar valves, they lead from the hearts to the greater vessels. So again, pulmonary valve to the pulmonary trunk, and the aortic valve to the aorta. Now the heart valves, so again, so this is another thing I want you to know. Where do these valves connect? Where are they located between? So let's talk about our blood flow through the heart again. So we have deoxygenated blood returning from the body, filling the right atrium, and between the right atrium and the right ventricle, we have our tricuspid valve. Now between the right ventricle and the pulmonary trunk, we have the pulmonary valve. And then we have deoxygenated blood going to the lungs and returning from the lungs as oxygenated. And then what we have here is that the left atrium over here collects all the oxygenated blood. And then, so left atrium to the left ventricle. And what do we have between the left atrium and left ventricle? The corresponding AV valve on the left side, which is called the mitral valve, also known as the bicuspid valve. And then from the left ventricle up into the aorta, what do we have between the left ventricle and the aorta? We have the aortic valve. So this is why I want you to definitely know not only the flow of blood through the heart and the pulmonary and systemic circuits, but also the order where these valves are located along this pathway. So here's a great mnemonic, and if you didn't step foot on the island yet, you might not get this, but I like to think of it as a pigeon mnemonic. So what do you have here? So say you want to pick with a fight with someone who studies anatomy. You might say, what? You like try pull my aorta? Ooh, so what we have here is tricuspid, pulmonary, and then mitral and aorta. So this tells you the sequence. If you start with deoxygenated blood from the heart, and this tells you the sequence that blood travels through as you go from deoxygenated blood entering the right atrium all the way to the aorta. So this tells you the order of these valves. And also by the number of papillary muscles, yes, that's correct as well. And in the time we have left, systole and diastole. So systole refers to contraction, and you definitely have to know these two. If you don't understand systole and diastole, you won't understand the heart and cardiac physiology at all. So my mnemonic is systole is squeeze. Systole, squeeze. So when the heart contracts and squeezes, that is systole. Diastole is relaxation, so there's no relaxation. So my mnemonic for that is that diastole is downtime and dilate. So dilate is something that you should add to your vocabulary if you don't have it in your vocabulary already. So dilate means growing bigger. So downtime and dilate. So systole, squeeze, you get smaller, you increase the pressure, dilate, and then diastole, you dilate, downtime, and relax. And I think this is a good place to end, and we'll cover coronary vessels when we return on Monday, and then hopefully get into cardiac physiology as well.